I'm going to begin now. So welcome, everyone. Thank you very much for your time and attendance to join us today. Hello, everyone. Keep firing away in the chat. That's great. Very appreciated. We're going to be introducing our Sustainability Accelerator tool to you today, and that's the main thrust of that tool is enabling hospitals and healthcare leaders to advance on their sustainability journey. We're going to frame that a little bit first before we move into a live demo, and then we're going to move into some other points as well, of course, and a Q&A. I'm just going to actually ask to change the slide. So just to introduce myself, my name is Ryan Crowder. I'm the program lead for strategic initiatives at the Geneva Sustainability Centre. You're going to hear the acronym GSC a lot today. That's what we're referring to. And I'm heading the project for the SAT, which is the Sustainability Accelerator tool. And I'm going to shift it over now to Carmen just to do a little introduction on herself.
Hello, everyone. Thank you for joining us. I'm Carmen Menendez, Senior Project Officer at the GSC, and I'm going to hand it over to Romina.
Hi. Hello, everyone. Super excited to be here today. My name is Romina Chun. I'm based in Zurich, Deloitte, Switzerland, and I have been working together with the GSC team on the Sustainability Accelerator tool as a global project program manager, handing it over to Sonia.
Thank you so much. I'm Sonia Roshnik. I'm the Executive Director of the Geneva Sustainability Centre. I'm delighted to be on this call with you today, and I hope we have a really good conversation and provide you with a lot of information on our accelerator today. So I think the one, if we can have the next slide, I was just wondering about, just sort of grounding us a little bit about why we might be considering that a tool could be useful, an accelerator tool in particular. And as many of us know, obviously climate change is with us. It's a real health crisis, and the health sector contributes to this situation. And the numbers that have, varied between 4% and 6% in the last few years. But the thing that strikes me always hugely is that this is more really than aviation and shipping as sectors put together. So our sectors are really highly polluting, highly accountable organization or sector that we need to be taking steps to do something about. And I think the other thing that's very clear, and I'm talking to you from Madrid today, where there's been a big WHO meeting on what health systems and healthcare organizations should be doing in this space, is that, regulation and national approaches are going to be coming our way. And it's definitely getting stronger. Ministries of health around the world are grappling with how to do this to best effect. And we would suggest that getting ahead of the game is really worthwhile doing. The other thing, though, that might be worth mentioning really is that, taking action, the good news story is that by taking action, we can really reduce health impacts of climate change and improve health for people in general. So this is, one way of ensuring that we can improve health as well as manage the sustainability situation in our hospitals. And the other one is that actually by tackling it in the right way and tackling it early, we could make savings. So this is not something that's necessarily going to cost everyone, but we feel that it's, the earlier you can act on this and the more you can be proactive about it, the more likely you are to be able to make some savings. So I'm going to leave it there because we'd really like to hear a little bit from you before we go into the conversation. And I'm going to hand over to Ryan again. Thank you.
Thank you very much, Sonia. Just have the next slide, please. Thank you very much. So we just want to take a moment, a little bit more, as Sonia mentioned, about your own sustainability journey. And to do that, we just ask you, if you have a phone with you that's connected to the internet, if you could scan this QR code and open up, and you'll open up Mentimeter, and you'll be able to answer a question very simply. We're going to have 3 of these questions, and we just want to get a little bit of an understanding again around where you are on your journey, some of the challenges you're facing, and some of the actions you've taken to address those challenges. If you're not on if you don't have a phone, you can always visit menti.com at the top on the right here and just put in that number, and that'll bring up the same questions. So we'll give you just a few moments to move over. We'll give about 20-30 seconds here just so you can take a shot at that, and then we're going to switch over and take a look at the screen and talk that through. Thank you, Carmen. So we'll just wait a few more moments here. So thus far, resilience is becoming the most sought discussion point, which I think is what we may have anticipated. We see actually a few as well, some points specific to national context or regional context, perhaps around carbon. So we got a net zero emission by 2050, carbon neutral 2040. A lot of talk around that. So compliance as well, and I think this speaks to Sonia's point around making sure that we get ahead of regulations coming down. If you're in the U.S., I imagine you have very varied state regulations. We've been speaking a lot to California hospitals and speaking about hospitals in the Southeast as well, specifically. So varieties of different approaches there. Bringing back the 1990s here, which is quite lovely around recycle, which is quite nice to see that again, and compliance and taking certain steps in that direction. Energy, yes, certainly to more degrees than we speak to. Obviously, energy is one of the major points, and we see a great deal around not only safe energy and saving energy, but also efficiency, of course, as well. Very, very helpful. Let's go to the next question now, Carmen. If we could just switch over. So you're now going to see the next question on the same Menti, so you can use the same screen you're in before, and we'll shift over to the next question quickly. And this question here is, what is the main challenge you're facing when implementing sustainability in your organization? I see a comment came in around funding. That's certainly a universal point to address, and we'll talk a little bit more about that as well. So it's, thus far, it looks like identifying, still more participants coming here, identifying where to focus sustainability efforts. Excellent point. Strategizing, one of the great questions around where are we on our journey, and then a flexion point around what are some of the interventions we can take, what is the best, maybe the most cost effective, some of the biggest impact. Maybe we only have a small team, so we have to strategize accordingly. We'll talk about that quite soon. And also identifying how to drive impact within the organization, exceptionally important in the community. We take an aspect on hospitals and healthcare systems as center points in the community, and not as a hermetic shell, something that actually we need to work with the community as well a great deal to push this forward. The point about false beliefs regarding costs, we're glad to see there's a lot of points in that one seems to be continuing to add. It's something that's exceptionally well felt around the world. And really, it's a matter of convincing and understanding the ROI differences of sustainability more than anything. I think we'll wait there then, Carmen. We'll go to the last question, and then we'll move on to a little more information before we move into a demonstration. This last question here is, what is your current approach to address these challenges? So if you are feeling these challenges currently in your specific organization, in your specific, perhaps in your unit, perhaps in your remit, across your system, what are some of the ways you're actually dealing with this? We'll give you a few moments now to answer that as well. I see funding got a lot of support in the chat as well, which is very nice to see. Yeah, support to hire staff, indeed. So lack of capacity, perhaps, and wrapping here the vast project around recycling. Yeah, indeed. So one of the points we've found a lot as well in our research for what we're going to show you today as well is really this difficulty around prioritization and determining what's the way forward. So a vast array here, really, over the time. So behavioral change is one of the themes that's come up a great deal here around changing, whether it be leadership, whether it be grassroots across the organization. So we lots of likes on a few of those as well. So commitment to training, committees around that as well, developing in that capacity. Could I ask you to move up just a little bit, Carmen, if you can? Thank you very much. Maybe just a little bit further, please. Thank you. Indeed. So funding, again, taking a scope 1, 2, 3 approach, learning energy use and reduction. So some fundamental things here, again, providing, but it seems that one of the main things, if nothing else, is capacity building, committing to getting our leadership on board, understanding what is the strategy requirements, making sure that we have the information we need to make those moves in the right direction. And at the same time, take actionable steps that matter as well. And so I see a lot about committees. Must be a very committee-friendly approach to some of our viewers today. And Dave, thank you very much for that. No, that's extremely helpful. We're gonna leave that. Oh, I see addressing scope 1 quickly as well. Absolutely. So finding maybe some quick wins, as we say, they could make some big impact and build momentum accordingly. Very, very helpful. We're just going to shift now to the next slide. Thank you very much, Carmen. And thank you very much, everyone, for your participation. Just as a summit of points, so we've had countless conversations now with hospital systems, individuals, sustainability officers, professionals around the world, in a way to figure out what are the major motivating factors now to engage on sustainability and to consolidate those. And you'll see a lot of the points that have just been brought up in those questions articulated here. So the first, obviously, is understanding how sustainability practice can reduce the cost of healthcare delivery. We strongly believe that's not only possible, but is viable and proven with a variety of different case studies around the world. Leading by action and leading by example, encouraging others to take that action. So again, not looking at a hospital as a hermetic unit, looking at something that we can actually provide this information, strategize, share information across systems, and work together to work on this. And sustainability, of course, is a global concern. So this really works well within the theme. Anticipating and being prepared ahead of new regulations on sustainability. Countless conversations we've had now, whether sustainability regulations are coming in, whether regulations are not quite understood, what's going to happen, the sort of a little bit of trepidation around the fact that there's going to be regulations, but we don't know quite what to do about that yet. There's a lot of concern about that, and we saw that a lot in the conversation. A lot of the points have been brought up in those answers. And lastly, learning. I think that was the most discussed point, and something that's constantly brought up, and something that we do as the Geneva Sustainability Centre is build that capacity, build those capabilities within teams more than anything. And what we're going to present you today is another means by which we're approaching that aim here. And so we're going to shift to the next slide, if that's all right. Just to present and to frame what we're going to show you today, we're very happy to partners with our friends at Deloitte to have worked a great deal with us over the last few years to develop this tool and develop an approach to a collective goal of making healthcare low carbon, resilient, and sustainable for people's benefits. So for us, this is an exceptionally important partnership. It's something we've really worked towards, and finding partners that can develop tools, that can develop new approaches, that can make connections, so we can really make sure that we raise the profile of sustainability around the world. And I believe I'll shift it off now to my colleague, Romina, who will take us through the tool. Thank you, Romina.
Thank you, Ryan. So moving forward, what is the Sustainability Accelerator tool? Well, this tool is a web-based platform which we hope that can empower not only leaders within healthcare organization and hospital, but also your staff members to understand how they can move forward and advance on their sustainability journey. And before diving into a demonstration, I would like to highlight some of the key benefits that we've identified and that we've heard from the few hospitals that have already started using the tool. And the first aspect is providing an effective way of making decisions towards advancing your sustainability strategy by providing you with comprehensive sustainability maturity insights through a maturity assessment. The second one is providing you with the ability to have more of an in-depth understanding through quantitative data of what is your performance, but most importantly as well, to compare yourself with other peers within the sector. So for example, I'm in Switzerland right now. How am I doing compared to another organization within my country, but also beyond the borders, so that you can gain a sector intelligence in some ways. But more importantly, and also supported by some of the key activities from the Geneva Sustainability Centre, is building sustainability capacities, not only for executives, but also through staff, through learning programs. So for example, use cases, good practices, or master classes. So with that being said, I'm going to start sharing my screen so that I can tell you a little bit more about the tool. So just if you can just thumb up as soon as you see my screen. Okay, looks like it's working. So welcome to the Sustainability Accelerator tool. So the foundation of the tool was actually great work that we've done together with the GSC, Deloitte, but also, stakeholders within the sector, experts and leaders there, in order to understand what is the framework, what is the foundation of the tool. And we have defined 3 core pillars of our sustainability assessment, which is environmental impact, health equity, and well-being, and leadership and governance. And this framework has been aligned with some of the ESG and GRI standards. And actually the GSC is working very closely with the GCI to see how we can continuously evolve this framework in order to align and not only with accreditation bodies, but also with the evolving standards and regulation and procurement needs. So in this welcome page, you get a little bit of a better understanding of what our sustainability assessment is about. So let me show you what type of functionality is the sustainability assessment. And I've noted a few challenges that are coming up is educational. So what we hope to bring to the sustainability assessment is a set of 56 questions that are more qualitative to understand where do you stand on your sustainability journey. So it's always linked to the framework and the domains of environmental impact, health equity and well-being, and leadership and governance. And under it, we have also subdomains. So just to give you an example of question, we would ask to the user would be, does your organization measure the energy of its facilities related to activities, for example, like transporting patients? What are the proportion of current energy use that are from renewable resources? And so you could always answer from the lowest maturity to the highest maturity. So for example, no, my organization is not aware or monitoring that. They are monitoring the energy use. They are monitoring all of key metrics related to those activities, or they are even implementing actions in order to improve basically operations. What we hope this questionnaire to do is not only just understand where you stand on your maturity journey, but also we see it as an educational tool that you could workshop within your organization in order, for example, to align leadership team and provide them with the same understanding of what sustainability entails. What are some areas that we should start thinking about? And so not only is it empowering your staff to provide the same understanding to other users, but also yourself to understand where you stand on your sustainability journey. Now, you go through the questionnaire. I won't be going through the 56 questions with you because at the end of I would see the dropouts from this webinar. So let me move forward maybe to the type of dashboards that you get. So after going through the different questions from the different domains, you would receive your maturity result. So this is the report dashboard that you will land on. So just to help you navigate a little bit this dashboard. So on the left side, you will always have a quick explanation about where do you stand from an overall perspective on your sustainability journey with, okay, what does that mean for me? And then on the right side, you would have a little bit of a deeper insights into how am I doing from across the different domains. So for example, as you can see, you have pretty much, and of course, these are not data for the purpose of this demonstration, but you could see, for example, from an environmental perspective, I'm actually doing less good than health equity and well-being and leadership and governance. And then you would also be able to dive deeper into, okay, why am I doing not so great environmental impact? Then you could dive deeper basically into the reports for that. Similarly for health equity and well-being. So if I take one example, which showcased that health vulnerability assessment is one subdomain in which I'm not doing so well compared to the other subdomains. What I would like to understand in that point is, how can I do better? And this is where we have also developed a knowledge functionality, which provides you what we call guidance to improve. We don't like to position them more as quick wins, but more action-oriented step that you can implement within your sustainability strategy. Or we talked about funding as well. Then you can also understand where could, for example, you could look for your next initiatives investment. So going back to health vulnerability assessment, here you would have always an indication of, what does that mean? I'm at an entry level, and you would have below a guidance to improve. So just to give you an example, you could develop a basic understanding of population demographics of the community served by the organization, as well as a baseline data. So this would be some kind of action-oriented step that you could take in order to better understand how to move forward within your sustainability journey. So this is just a quick overview of what kind of report does the sustainability assessment provides you. The second functionality is more of a quantitative oriented dashboard and reporting, which would allow you to understand a little bit better. And before just going forward, one thing which I forgot to mention, and quite important in fact, is the benchmark. So we often get question around what does this benchmark insight provide? Well, it tells you where do you stand on your sustainability journey compared to other hospitals and healthcare organizations which are currently have taken the sustainability assessment within the tool. So it's aggregated data and it's an average. It gives you more of a global understanding of your sustainability journey. Now, going to the second functionality, which is the KPIs. So here, where I go right now is where you would basically have an understanding of what are the 23 core KPIs we start measuring your performance against. So we have defined them, and it was a thorough exercise to understand what could be global standards that could be easily comparable from one region to another, but also the basic standard ones. And just to give you an example, the whole framework and the whole approach that we've developed is focused for the healthcare. So it's not generic approach, sustainability measures. It's very much oriented to your organization's landscape. So just to give you an example of the type of indicators that we track is, for example, annual energy consumption per patient covered. And against that, we have also annual energy consumption per square meter. Why I like to take this indicator as an example is that you can see the second indicator could very much tell you, hey, actually, my energy consumption is pretty good because I have a high square footage, for example. But when you look at the proportion of patients that you currently are serving, well, it's not that great. And this is the type of indicators that we put in perspective. And again, it's always linked to the three core domains of environmental impact, health equity and well-being, and leadership and governance. So basically, you would be able to fill in those data. It could be also related to annual carbon emission, which is also related to environmental impact. Or you could go into health equity and well-being, which is, for example, the percentage of employee trained on health vulnerabilities. So once you've completed the input of the KPIs, you will go into a much more detailed dashboard. In this dashboard, what you will be able to see, and it takes a couple of seconds to generate, is a more detail on the review of what is your performance against the 23 core indicators that we have defined. So what you see right now on the dashboard is the overview, for example, the environmental impact domain, but you could also navigate against the other two domains. Here you would have an insight of, okay, this is my performance. And what is important to highlight is that what we want to provide is also insights on how you're doing compared to other organizations. So a global benchmark, essentially. So you could see, okay, how is the highest performing hospital doing from an energy consumption perspective, and how is the lowest hospital doing, so that you can benchmark yourself against other organizations. What we've heard also, and what we've developed as part of a functionality, is the ability to filter basically those reports based on your needs. So let's say, for example, I'm based in Switzerland and I only want to see Swiss data or the US, then I'm able to filter that again, United States data, and my dashboard gets quickly updated. And so some of the criteria that will filtering those performance report again is the country income level, the size of the hospital in number of beds, and the type of hospital. So whether I'm a private, public entity or mixed. Now, Of course, if, for example, you focus your funding or your initiative in energy consumption, so you want to optimize the energy within your infrastructure, you could dive deeper into this performance report and you could see your progression over time. For the sake of this demonstration, we only have one data point, but the idea behind this is to provide you insights on how would my performance grow, and you could always, input data for the previous year so that you can see your progressions. So this is for the key performance indicator. And please, if you have any question, I invite you to use the chat. And of course, we'll have a Q&A later. The last part, which I will then hand over shortly to Carmen, is the knowledge resources. So once you understand where you stand on your journey, right, and you're equipped with more insights and comprehensive reports that you can bring back to your teams, to your leadership team, now's the time of, okay, how do I move forward? How do I strategize and plan my actions? So here's the knowledge reports where you would have a breadth of use cases, learning glass, workshops and training and glossary, which are continuously growing through the Geneva Sustainability Centre and through our tool. And with that, I'll be handing it over to you, Carmen, to tell a little bit more about what we are also offering through the tool or beyond the tool.
Thank you, Romina. So I'm just gonna go back to our slides. And yes, as Romina was mentioning, we have a collection of knowledge resources that is in constant evolution. We're regularly publishing new case studies, new learning guides for you to advance in your sustainability journey. And same as our resources, it's important to mention that the framework of the Sustainability Accelerator tool and the tool itself, it will keep evolving over time. And it will adapt to the trends and the needs of the healthcare sector. And so with the Sustainability Accelerator tool, what we want to do is maximize the opportunity that we have in this sector and also create a hospital movement around sustainability. And the Sustainability Accelerator tool, as my colleagues already mentioned, is just one of the ways in which we can support your organization. Additionally, through our learning program, we also help healthcare leaders drive the reduction of hospital emissions and transition towards low carbon, sustainable and resilient healthcare. Our mission at the Geneva Sustainability Centre is really to equip leaders like yourselves with the skills and tools that allow you to turn this knowledge into action. Another way in which we can support your organization is through accreditation. We partner with the Joint Commission International to develop environmental sustainability standards for their 8th edition, which will be published in July this year. And these standards are precisely inspired in the framework of the Sustainability Accelerator tool. And therefore, the Sustainability Accelerator tool will be a useful guide and preparation for hospitals to obtain Joint Commission International accreditation. It is important to mention also that these standards will be made available for other accrediting organizations globally. So even if your organization is not accredited by the Joint Commission International, it is highly likely that your accreditation standards will soon include sustainability measures. A last point to mention is that through the work we do at the Geneva Sustainability Centre, we also provide you access to the global network of the International Hospital Federation. And in this network, you can learn and get inspiration from organizations around the globe that are facing the same challenges as your organization. And we actually saw this during the pilot phase of the Sustainability Accelerator tool, which demonstrated its relevance in really different contexts. And it showed how, besides providing all the benefits that Ryan and Romina already mentioned, it's influencing the strategies, the sustainability strategies of these hospitals. So the SAT has enabled them to identify the areas of improvement, to assess what could be the priorities, what could be the next actions to take. And we can actually see from these hospitals that are doing already a lot of progress, but most importantly, they're also willing to keep advancing in this journey, collaborating, learning from others, and also sharing their good practices. And through the Sustainability Accelerator tool, they're able to do all this. So we want you to to imagine a future where we can build this movement around sustainability and we can collaborate to improve health outcomes through sustainability. And we encourage you and invite you to please share your thoughts, your questions, and we'll be happy to answer